Thank you for joining us. I'm Dr. Mark Castellaw with Baptist Medical Group. Today on Health Matters, we've talked about diabetes, and now my next guest is Suzanne Gentry. She is a diabetic educator with Baptist Hospital. Thank you for joining us.
You're welcome.
All right, Suzanne, if someone just has been diagnosed with diabetes, they went to see their doctor, they got their lab work, got their hemoglobin A1C, may or may not been prescribed medicine, and now they've been referred to you for education about their diet. What are some of the first things that you talk to them about?
Well, measurable behavioral change is the desired outcome of diabetes education. The American Diabetes Association believes that behavior change can be most effectively achieved by using the AADE-7 self-care behaviors framework. And
well, with diabetes, it's so important that it's a true behavioral change. It's not just something that medicine fix or exercise fix. It's a total behavioral change. And what are some examples of that?
That would be monitoring, taking your medication, exercising, reducing your risk, coping, eating healthy, being active.
You know, patients always ask me, and this is the key question I get from diabetics, what can I eat? How do you walk through with diabetics and tell them exactly what they should and shouldn't eat?
Well, we have a wonderful dietitian that works with our patients. But basically, they are told that most of them think that they come in and they think that they can never eat another carbohydrate the rest of their life. But, you know, that is not true. Basically, you just have to monitor and limit the amount of carbohydrates you take. But carbohydrates are still good for diabetics because when you have diabetes, you've got all your glucose, your blood sugar, everything's floating around in your blood, and normally your insulin breaks down your glucose for energy. Well, diabetics are missing that component, so it's real important that they do take in the right amount of carbohydrates that your body is able to break down, and then your body utilizes those for energy.
Don't you think that it's important for diabetics to take ownership in their disease and for them to be actively involved and be educated about their disease?
Absolutely, absolutely. Education is probably one of the best things that a patient can do for themselves.
So what are some of the things that you educate them about?
Well, we have 3 classes, and we educate on nutrition and exercise, long-term complications, monitoring, medications.
Now, do you see a long-term benefit by patients that have gone through your program and become educated? Do you actually have any kind of outcome data or see any benefit of patients going through your program?
We do. We always get a pre-A1C on everybody, pre-program A1C, and they come in, and that's usually the one that the doctors probably diagnosed them with diabetes on. And then we put them through our program, and then we bring them back in 3 months for a follow-up assessment and encourage them to go back to their doctor first, get another A1C drawn, and then they come back in, bring it to me, and 99.9% of the time we've had a significant drop in their A1C, and they've also dropped weight.
And that, to me, in our practice, that's such an encouraging thing for patients to get that positive feedback that, hey, you know, all this exercise and this special diet that I'm doing, it's paying off by my numbers getting better. And what do you say to encourage that with the patients?
Absolutely, and that is why we try to stick to those, you know, measurable behavioral changes, the 7 ones. We incorporate those in our classes because you have to have behavior change that is measurable, because if you teach them something that's not measurable, then you really don't know what their outcome is and when they've succeeded.
What's a couple other examples of measurable outcomes?
Healthy eating, being active, monitoring, taking your medications.
Well, to me, there's nothing more beneficial to a patient than for them to come in and say, hey, I lost 5 pounds.
Right.
And patients always ask, they say, well, how much weight should I lose? I always tell them, lose 1 pound.
Right.
That's all they have to do is lose 1 pound, and then next time lose another pound.
Right.
So try to give them little measurable goals for them to meet so they can get that positive reinforcement, because everybody is so, you know, they're depressed that they have the disease, they feel guilty about it oftentimes, but it's really sometimes not always in their control, but they certainly can benefit by programs like yours on modifying their behavior. In the last minute or so, tell us what patients need to do to get involved in your program.
All we need is your doctor's referral. So that just send us that, and then we contact you and set you up for an assessment visit and then enroll you in our classes.
And I think it's real important for our viewers out there, if you have diabetes, mention that to your doctor, that you would like to see a diabetic educator to learn more about your disease. The doctor may not always have time, or his nurse have time to explain all the nuances of type 2 diabetes, but Ms. Gentry and her organization certainly can. So be sure and remind your doctor, hey, I would like to know more about diabetes, because the more you know about diabetes, the better results that you'll have with type 2 diabetes. Well, thank you, Ms. Gentry.
Thank you.
And I'm Dr. Mark Castellaw. We'll be right back.